with an all-new episode at 10, only on CNBC.
The House is set to vote on a repeal of the health care law today. Georgia Republican Paul Broun introduced the repeal and replace bill, and he joins us from Washington this morning. Also with us, our friend from New Jersey and a frequent guest, Democrat Rob Andrews. Welcome to you both. Rob, I got to start with Congressman Brown just to outline what is the replace part of the repeal, because this is something that you tried to get some interest in before, and it didn't really go anywhere.
Actually, I challenged Democrats, even in an op-ed I wrote in the Washington Times, to introduce the bill so that it would be a Democratic bill. It does four things. Number one is it allows businesses and individuals to buy health insurance across state lines. Secondly, it allows people to join an association all across the country, businesses and individuals, so that there will be huge pools to literally reduce the cost of health insurance for everybody. Thirdly, it stimulates the states to set up high-risk pools to cover those people who are sick and uninsurable. And fourth, it allows everybody to deduct 100% of their health care costs off their income taxes. Those four pieces are not a comprehensive bill. Three-fourths of America want a step-by-step approach. This is a great first step to lower the cost of health care, to keep the doctor-patient relationship as how health care decisions are made, and to keep the good quality health care we have in America. And that's the reason I introduced it.
Congressman Andrews, are there parts of that plan that you like, and are there things that you would admit maybe we can improve on, even if it's not repealed in the health care bill we have?
Yes, Joe, to both of those questions. See, I would say a lot of the things that Paul talks about are already in this law. For instance, purchasing in larger pools. That's what the exchanges are that the states will be setting up in the next couple of years. The idea of encouraging sales across state lines, the exchanges are encouraged to form what are called interstate compacts, where states can form purchasing across state lines in that way. So yeah, I think there's a lot to recommend that. A lot of it's already in the law. As far as things that ought to be changed, there's a lot of things should be changed. The 1099 provision ought to go. We voted, frankly, to get rid of it last year. The Senate didn't make it up. I think there's some provisions about the tax credits for small businesses that don't work very well. So, sure, we should be open to these suggestions.
Well, you don't like the individual mandate either, Congressman Brown, right? And you also still posit that it is a baby step towards a single-payer system, right?
Absolutely.
I mean, is that what you think?
Well, absolutely. In fact, the public exchange that Rob's talking about is just the weakest form of a process of trying to push everybody into what the president said he wanted to go to, and that's a single-party payer system for everybody, which that means is socialized medicine, where the federal government controls it from Washington, D.C., and the doctor and patients can't make decisions. It has to be made from Washington, D.C. In fact, the whole debate on Obamacare was whether we were going to have a robust public option, or public exchange. All three of those are geared towards forcing everybody in this country into government insurance, where the federal government controls all health care decisions. We'll have ration of care. The quality of health care is going to go down. I, as a physician, cannot make decisions because some bureaucrat in Washington, D.C. is going to make them $4 million for my patients, and it's just wrong. We've got to do it in the private sector with market-based solutions. Now, when Rob was talking about the public option does these things, no, it doesn't. It seems to be by his definition, but actually the whole of Obamacare is geared to force everybody out of private insurance into public insurance policy, and we've just got to stop that. It's going to destroy the quality of health care.
That would be scary if that were true to some people, Congressman Andrews. Is this
Let me say, if it were true, I wouldn't have voted for the bill. Look, the bill that was signed last March essentially provides subsidies for moderate income people to buy private health insurance in a competitive market. It's what Bob Dole proposed in 1993 and John Chafee and some others. Look, read the comments yesterday, Joe, of Bill Frist.
I read those.
About this law.
I read those.
I think he knows a bit about health care. He's a pretty conservative Republican. He basically said that this is the structure on which we should build. I think some good ideas like Paul has should be incorporated, but sort of ripping this up from the roots and replacing it with nothing doesn't do much, and that's what they're proposing to do.
Rob, it's not nothing. I introduced my bill. It's H.R. 299 introduced yesterday that does those four things.
Are they going to put your
In
bill
fact,
on the floor?
Well, I think so. In fact, we've talked
so.
to my
Doug
leadership about that. So
I await that day. I
This
hope
is
so.
Doug Holtaken. I have a question for both of you.
Yeah. How are you, Doug?
Good, thank you. An indictment of the current law is that it has failed to control healthcare costs. CMS Actuary Rick Foster says healthcare spending is going to rise, not fall under the bill, and that we have flunked one of the key tenets of healthcare reform. So my question for you, Mr. Andrews, is how can you defend this bill if it doesn't solve the basic problem? And for you, Mr.
Well,
Brown,
Doug,
how
I
would
would
your
say-
bill solve the problem?
I would say to you, Doug, that as a terrific director of the CBO, you can't evaluate something until it's been in effect. Until the exchanges bring competition to the marketplace and have been here, until the IPAB changes, which is shorthand for the constraints on Medicare spending, until they take effect, you can't evaluate what it's going to do to health care
gotta
costs.
come
I
back.
think it's going to restrain them.
You guys got to come back, Congressman Brown. I can't.
I'd like that.
We can't let you. We got to end it there. I guess we're running out. The show ends at 9. They
does.
make us do that every day. Anyway, thank you, Congressman. Appreciate it.
Have a great day, guys.
Okay, you too.
All right, coming up.